Communication is how we connect with the world around us. It's how we express ourselves, share what we need, and stay close to the people we care about. But let's be honest, communication isn't always easy. And when Parkinson's is part of your life, whether you have it or someone you love does, it can make things even more challenging. Today, we're talking about communication in Parkinson's. We'll explore symptoms that can make expressing yourself harder. We'll talk about feelings and experiences that can be tough to put into words. And we'll share practical tools to help you and your loved ones communicate better, even if things already feel pretty solid. There's a lot to cover, so you'll be hearing from two different experts. First, a speech-language pathologist will explain Parkinson's-related changes in voice, speech, and thinking, and the treatments and tools that can help. Then, a mental health counselor will zoom out to the bigger picture, what communication is, how Parkinson's can affect it, and what we can do to strengthen it. I truly hope these discussions help you and your loved ones in regular conversations throughout life with Parkinson's. I'm here with Alexandria Wynter Russell, who's a speech-language pathologist who cares for older adults and underserved communities in Philadelphia. Alex is committed to compassionate, person-centered care that empowers both people living with disease and their care partners. And her work is deeply personal too, as she was a care partner to her father who lived with Parkinson's disease and dementia. Thank you so much for being here, Alex.
Thanks for having me.
We're talking about an area of your expertise, speech and voice changes that can happen with Parkinson's. And they don't happen in everybody, but they can happen. Tell us a little bit about these changes and why they happen.
Research does tell us that about 90% of people with Parkinson's will develop some sort of changes in their speech and their voice. Those changes look like decreased volume, a breathy voice. We also want to think of the masked face, which can also impact communication. Dysarthria is another common speech change that can happen in people with Parkinson's.
And what is dysarthria?
Dysarthria is a motor speech disorder that impacts how someone is going to express themselves. So the muscles that they use for speech are not moving quite like they used to. And so speech is often going to come out slurred. The rate of speech might also be impacted. So they can't talk as loud as they used to. Even starting a conversation, initiating a conversation might be different.
Another one too is that we might have less emotion expressed in our voice.
Yeah, the inflection in the voice is not there. And so many people with Parkinson's will present with a monotone or mono-pitch voice. If you're excited, you may not look excited or sound excited. Right? And so that can really play a role in someone with Parkinson's even wanting to express themselves if someone is not perceiving their message quite like how they intended it to be perceived.
Tell us how, as a speech therapist or speech-language pathologist, you can help people with Parkinson's.
So speech therapists, we evaluate cognition, speech, language, voice, and swallowing. All things that can be impacted in someone's journey with Parkinson's. It can happen at any stage of your Parkinson's journey, you needing to see a speech therapist. In fact, I think it's a great idea, since it's a progressive condition, to see a speech therapist, establish a baseline of where your skills are, so you know if anything changes, when you might need to see that speech therapist again, if that's not the right time.
So for speech and voice, for example, what would the kinds of tools or treatments that you use look like?
So within speech and voice, you can go the traditional speech and therapy voice route. That might look like exercises to improve vocal projection, your loudness. Therapy might include pacing or articulation techniques, caregiver coaching. It might look like training in using certain communication supports like communication devices, communication boards. And then we also have, within the realm of speech therapy, more specialized treatments for speech and voice. And those you probably have heard of: the Lee Silverman voice treatment, LSVT, and then the Speak Out therapy program. You do need a speech language pathologist who's been certified in those specific protocols, no matter if you're doing speak out or LSVT or traditional speech and voice therapy. Practicing your voice and speech and using those tools every day is going to help contribute to your progress.
You mentioned things like pacing or projection, or what does that actually look like in practice to help with your voice and your speech?
So when we work on these pacing techniques or articulation techniques, it might look like actually visually breaking up what you have to say. So you are kind of forced to take that line break and pause. It might look like visual cues, maybe me actually signaling to the patient, maybe highlighting somewhere where they need to pause. We also work on breath support and making sure our patients can take that deep enough breath, or a diaphragmatic breath, as we call in the speech therapy world, to make sure they are projecting their voice and speaking loud enough. Because the one thing with Parkinson's, another one of those non-motor symptoms, is decreased biofeedback or decreased auditory feedback. So people with Parkinson's can't hear themselves like they did before. So oftentimes caregivers will say, well, I tell them to speak up all the time. Say it again, say it again. And they say it again the exact same way, but they think they're saying it louder, right? Because they don't have that feedback piece to actually hear how loud or how clear they're being. So it's not always helpful to say it again, right? Speak loudly, but working on these techniques in therapy and outside of therapy to make sure they have good breath support, good loudness, good intelligibility, good pacing, to make sure they're understood in whatever situations they need to speak in.
What are the tips people can use in their everyday when they're talking with their care partner over the breakfast table, or trying to yell from another room like we tend to do, or even just in social settings? What are the kinds of things you would work on there?
I would say always take a breath before you speak. Take a nice deep breath. Make sure you're speaking on your exhale, so air is coming out, not coming in as you're speaking. And then we want to try to control the environment as much as we can. So making sure that people are standing close enough to each other, that it's well lit, that there's not too many distractions. And then also sharing with caregivers, let's use simple language. Let's leave time to process information, leave time to respond, and try not to rapid fire. How are you doing today? What's going on? Well, did you tell the doctor about this? Oh, where are your glasses? Right? That's like way too many questions at once. So really trying to simplify the conversation and letting your loved one process what you're saying and giving them time to respond.
Those are really helpful tools. What about for facial masking or changes in face expression? What kinds of tools and tricks do you give people for that symptom?
Yeah, I would say one of the things that I've done in therapy with some of my patients is using a mirror, because again, they may not see how their face looks when they're communicating. So we might work on speech and voice exercises, or just having a conversation with that visual feedback themselves so they can see what their face looks like. And we might even work on a few lip or cheek exercises so they are moving their face a little bit more, even if it's raising the eyebrows or smiling big, and kind of doing everything exaggerated so they can get those big movements, which are often decreased in the Parkinson's journey.
And say a little bit more about how you can help with the memory and thinking changes, because this is an area that, again, not everybody struggles with Parkinson's, but really can happen. And I think a lot of people might not be aware that speech therapists can help.
Our name is tricky. It says speech therapy, but we do deal with cognition as well. And so kind of similar to speech and voice, changing the environment to help support cognition. So whether we need to keep the keys, the glasses, the cell phone, and the remotes, like all in a basket in the same place, so we know where things are all the time. Calendars are great. Whiteboards, nice big visual cues that people can see. Pictures, maybe to sequence a routine, like brushing your teeth. Maybe we're forgetting the toothpaste or we're forgetting the mouthwash, like including those visuals to help your loved one put those steps back together if maybe they're forgetting a few. And one thing that's really important is routine as well. I think too, as people get older, they tend to lose, or can tend to lose, some of that routine in their life. So making sure that they have a routine, because that's going to help their brain and help them to remember things a little bit better.
And I really like this tip you give around sequencing. So you mentioned how when cognition or thinking changes, sometimes it's hard to do a task, but task can be everything from making your sandwich for lunch to taking a shower to all these other things that we do throughout the day. And so you have some ways of laying out the sequence of the task.
Yes. Yeah. I think visuals are great, and written as well if your loved one still has the ability to read. But giving them something to look at or to follow along, or something that they can read out loud and practice and do repetitively, again, to help their brain remember that sequence or hold on to that task a little bit longer. And again, right, that routine piece is going to come into play, and letting your loved one do it. I think, too, sometimes caregivers, we might want to jump in and do it for our loved one, but, give their brain the opportunity to relearn that skill or strengthen that skill.
So it's this balance of how do you support but not overtake.
Yeah.
Talk to us a little bit more about the different kinds of tools and devices that can help with communication when speech, voice, cognition are impacted.
We break that up into low tech and high tech. Low tech is going to be paper-based methods, so writing, body gestures. We can communicate in so many ways, right? And then high tech is going to refer to like electronic-based methods. So using an app, texting, maybe even using a communication device, which will be like a small tablet or small computer that has a series of folders and cards with images and words that you can customize to say whatever you want, right? So maybe it's an off day for you, and you have a doctor's appointment coming up and you want to tell them about your new symptoms. You can program that into a communication device. I'm having more tremors. I fell yesterday. I'm having trouble swallowing. And if you can't say it at the time of your appointment, you can press that card and it'll speak for you.
And it's really neat that it can help with all these different things, whether you need to project your voice more loudly or you need help with typing or texting or whatever it is. What should people and families watch for to signal that it might be a good idea to see a speech therapist or to revisit their speech therapist?
If we're talking about swallowing, coughing on foods, coughing on liquids, within speech and voice, it might look like a very hoarse, very breathy, very low voice. Maybe family members are saying, well, we can't understand him at all anymore. Within language and cognition, it might look like word finding difficulties, substituting words, mixing up words. It may look like trouble remembering things you could do yesterday, right? So if you are noticing things aren't quite how they used to be, that is a good sign to ask for a speech therapy evaluation.
What would you say to people who say, I already have a doctor, I have these other medical providers, I have so many appointments. Do I really need another provider and more appointments?
Yes. And it's great to have a team behind you, especially while you're navigating this Parkinson's journey, not only as the person living with Parkinson's, but for the care partners in their lives as well. We need a team-based approach to do this. It shouldn't just be your neurologist or just the movement disorder specialist or just the physical therapist, which I feel like are the big three that we talk about, but there's so many other people that can support you in living well and aging well with this disease, whether that's speech therapy, social work, occupational therapy. And I know speaking from personal experience as a care partner helping my mom navigate the journey of my dad living with Parkinson's, having that team-based approach and making sure that everyone on your team, so all of those providers, are talking to each other, can also help reduce overwhelm.
And is there anything else you want to leave our viewers with, people and families who are navigating communication challenges with Parkinson's?
Just to know that you're definitely not alone. You're not doing anything wrong. Changes in communication are part of the disease. And please know that there are things that you can do, simple things that you can do that can improve your speech, improve your communication. You don't have to live this way. You can do things to help.
Thank you so much, Alex, for sharing your expertise, your personal experience. It's so encouraging to know that there are people like you that care so deeply and can really offer practical support to people and families who are living with Parkinson's.
Thank you so much for having me.
As we heard from Alex, Parkinson's can affect speech, voice, and even cognition. But there can also be other, often less visible, shifts with the disease. In this next interview, we'll discuss the broader impact Parkinson's can have on communication and strategies for how to have more productive and compassionate conversations. I'm here with Bradley McDaniels, a rehabilitation counselor and associate professor at the University of North Texas. Brad's work focuses on the emotional and mental sides of life with Parkinson's. He also has a personal connection to the disease. His mom has been living with Parkinson's since 2012, and she and her diagnosis were the reasons Brad went back to school and changed careers to his current one. Brad, thank you so much for being here.
Thank you for having me, Rachel.
First question, what is a rehabilitation counselor?
I get that all the time. Rehabilitation counseling is a field that helps people who have been diagnosed with a chronic illness or encountered a disability. How do they adapt to their new life and improve quality of life along the way?
And communication is probably a big part of how you adapt to life with something like Parkinson's.
It is, right? It's how do I talk about this new thing that maybe I don't even understand yet? And people are asking me what's going on, and I'm trying to figure out how do I articulate that effectively and honestly.
When it comes to life with Parkinson's, one of the things many people and families with Parkinson's, us as professionals say is talk. Talk early, talk often, talk about the things you don't want to talk about.
Yeah.
And what we're really saying is communicate. So what is communication and how is it different from talking?
I think that when we think of communication, I think it's where you started. We think about talking to someone, saying something to someone, conveying information. That's a piece of it. But as we think about the word communication, the Latin root for that is communicare, which means to share or to make common. And so communication requires two people. Really what it is, it's about what is the effect of what I'm saying on someone else? How can we engage in such a way that we both share meaning and we understand what we're saying? And so it's much more than words, right? It's gestures, it's tone, it's context.
We've talked about speech and voice and language changes that can come with Parkinson's for some people. But what are the other ways that communication might change because of life with Parkinson's?
I think one of the main ways that it can change is we have role changes in life, right? And so you get the diagnosis of Parkinson's disease, and it's very possible that you were, let's say, the primary breadwinner in your home. That role may now change, and you may be the one who's being taken care of. And so that affects how I feel about myself, my personal identity. And, communication is part what I say to myself too, not just the way that I'm communicating with you. So if I'm viewing myself as less than, not as good as I used to be, maybe a burden, it's going to make my willingness to engage, my willingness to share those feelings, because I'm struggling with how I feel. So I think that's one piece of it. I think the other piece of it, particularly, is how it affects autonomy. When a diagnosis of Parkinson's disease happens, oftentimes we're relying on other people so much that our autonomy can be lost in that. And so I think even with that, it can result in some anger, some frustration, some disgust along the way that affects how I engage with not only the person who's living in my home, but with friends and with the medical community.
So it can impact how we feel about and how we communicate with ourselves, which can then also impact how we communicate with other people.
Absolutely. It's this cyclical process. Oftentimes, someone with Parkinson's struggles with knowing, was that a negative tone or a positive tone in the way that you said that? And it particularly matters in context and in the specific words that were used. And so that's one side of the coin. The other side of the coin is the care partners struggle with the lack of emotion, with facial masking, with people with Parkinson's.
Feelings, Parkinson's or not, can be hard for us to identify and to communicate. And then you add Parkinson's on, where there might be changes in facial expression, as you said, or changes even in the tone of how we're able to express emotion. And it sets a good stage for potential miscommunication.
Yeah, and then throw in things like depression, which is very common, things like anxiety, apathy, right? How do those mental health conditions begin to affect my willingness to communicate, my desire to communicate, and how I emotionally express myself? And you can imagine that that can just lead to a lot of struggles in a relationship.
There are things that we can do to set the stage for a productive conversation and productive communication. What do those look like?
Yeah, I think in general, one of the easy things that people can do is try to reduce cognitive load, right? One of the struggles I think that people with Parkinson's often have is, as cognitive changes are happening, they struggle to focus when there are a lot of things going on. So it might be that we need to turn the TV off. Maybe it's put the cell phones away. Maybe it's talk in a quiet place, particularly when we have something that's important to talk about. So I think that's one. I think the second thing is active listening, where I'm actually engaged, my head's nodding, and I'm making eye contact with you. And maybe I'm clarifying, asking clarifying questions if I'm not understanding, so that you realize that I'm actually engaged with you and we're on the same page. I think a third thing is empathy. Trying to understand where the other person is, right? Whether you're the care partner, trying to understand the challenges of someone who maybe newly diagnosed with PD, which is different, right, than as it progresses, but beginning to understand the struggles that they're facing with their life changes, their identity, their role changes. And the other way around, understanding as from the person with PD's perspective, the challenges that the care partner is now having to face. Maybe they weren't used to being the caregiver. Maybe now they're trying to navigate, how much do I help? Do I ask if I should help, or do I just help, right? And those things can be the unspoken part of communication challenges that we run into.
How do you actually check along the way with your mom without it feeling maybe like an uninvited break, or like it's reflecting on her memory or thinking changes?
I think, part of the communication process is I statements. I don't ever want to say, are you getting this? Are you clear? Because that indicates that it's your responsibility to understand what I'm saying. Rather, I'm going to say, Mom, have I made this clear? I talk to her every day. And I can tell in our phone conversations when she's not engaged, when maybe she's off, right? And so she's not able to communicate as well as she normally does. And sometimes I just have to postpone the conversation. We'll chat. I'll say, how are you? She'll share her day with me. But if there's something I really want to talk to her about, it might be, Mom, I'm going to call you later, and we'll revisit some things then.
Finding times when it's good for both of you. So for people with Parkinson's, that might be the time of day when you tend to be most on, or you're not fatigued, or more apathetic, you have less energy toward the end of the day. So it is about communicating about the times to communicate, right? And I think one thing too, that again, Parkinson's or not, we have to be on the same page about what we want to get out of the conversation. But I think sometimes in relationships, I may want to vent and my partner may want to problem solve. And if we're not clear going into that conversation, that can lead to miscommunication.
It can. It's even physiologic that when we have a good connection with someone, that we're going to feel that. And so again, it's this cyclical process. I'm feeling better. I feel like they trust me. My stress is down. Therefore, I'm going to communicate even more.
That's so important, especially in Parkinson's, where many people say they feel more stress. And we know that stress can worsen symptoms. So if you can have that positive connection and communication, it can actually work to lower your stress. You mentioned anxiety. We've also talked about fatigue, but there are many of these other quote unquote invisible symptoms of Parkinson's that many people can find it's hard to talk about. And many people ask, how do I actually share my experience so that other people understand what I'm going through? What do you say to them?
I think the first step in that is getting to a place where I can accept this is the situation that I'm in. I have Parkinson's disease. Right? That's not going to change. And understanding that it's not something I did wrong to get this. It's just, it happens to some people, right?
And if I can say one thing on that, because Michael has a great quote about acceptance. Acceptance doesn't mean resignation. So it simply means this is how it is. And now that I acknowledge that and I'm able to incorporate that in my life, I can move forward.
And that's such a great point, because it doesn't mean I love it. It just means that it is what it is. I think once we get to that point, then we're much more willing to have conversations with other people. And I think part of that of communication is being able to be assertive, which is being able to say what I feel, being able to say what's on my mind comfortably and in a way that elicits some feedback and starts a conversation.
Are there specifics you can tell people about, say, anxiety, for example, and it's really hard to explain to somebody else what anxiety feels like to me?
You know, I think something like anxiety it's like whenever, let's say it's a social anxiety, right? Whenever I'm around other people, I begin to sweat. I have this tightening in my chest. I lose words. My thinking gets erratic. Those are the symptoms that someone might have who has anxiety. And I think being able to share that allows me to be able to maybe intervene, maybe communicate with you in such a way that can lessen that anxiety. And again, I even think of normalization, right? You share that with me and I go, you know what, I get it. Because there are often times that I'm in a situation and I begin to feel my chest tighten and lose my words. So I can imagine what kind of a challenge that must be for you. And so I think that's one. I think depression is another one. That we have this misnomer about depression. It's this negative, pejorative term, if you will, that's so bad. But so many people, I think, if they knew what depression was, would go, I experienced some of that in my life. I experienced a lack of joy. And I think it's learning that verbiage that you can say, and again, practicing with someone whom you're close with.
You've mentioned changes in identity, changes in roles. These are a little bit different, of course, than the symptoms we've been talking about. And sometimes it's not so much how we can talk about it, it's whether we want to talk about it. So what do you tell people who are navigating those situations?
Yeah, I think those are tough ones, right? Because when I think about identity, you know, what's the first thing we typically ask someone when we meet them?
What do you do?
What do you do, right? And so imagine, I have a friend who he's an airline pilot, and he had been flying for 25 years, and he's got mild cognitive impairment, and he had to stop flying. And he was struggling with, what do I say when people, and he's like, I used to be a pilot, but I'm not anymore. And so that identity change is real. And I think what happens is we make assumptions about what other people are going to think when we are honest with them. Right? And lack of communication is communication. Because what happens is I allow other people to fill in the gaps. And those gaps, they usually fill in with negative thoughts. And so it's learning to say, you know what, this is who I am. I have Parkinson's, but it's not my identity.
You mentioned, a person with Parkinson's might have anxiety or might feel frustrated. Care partners might have a lot of the same feelings, whether it's guilt or anger at the disease or resentment. And this is an area that's really hard for a lot of care partners, wondering, should I express these things? How do I express them? Will they make my loved one feel worse?
And I think those things are also true. As a care partner, you walk in and your loved one's diagnosed with Parkinson's disease, your mind starts going just like theirs does. How is this going to change the way that we manage our home, the way that we pay our bills, the way that we raise our kids, the vacations that we had planned? All of these things start going, and there's this cascade of emotion that comes from that. And I think one of the things that's so beneficial for care partners is the support group system. And so they have the opportunity to sit with other care partners where they can vent. So I think having a group of people who can, again, talk about normalizing it, and then getting to a place where I can talk to my loved one who has Parkinson's honestly and openly and say, when this happens, I feel angry, I feel resentful, I feel depressed, right? And so again, we're naming the emotion, and so that now both people understand what that experience is like, and hopefully behavior can then be altered. But again, we can't change the problem if we don't identify it.
And one question back to your suggestion for support groups, they're not for everyone.
They're not.
So what if you don't have a support group or you don't like the idea of a support group? Who can you talk to?
I think you should hopefully will have a friend in your life who's a close friend. They may not understand Parkinson's disease, someone that you can at least just share your feelings with.
And it could also be a therapist or a counselor or somebody in your community who you trust as well. But as you said, just someone who you can be open and honest with, and they can be an objective listener. We've talked about a lot of things that can be difficult to talk about, but there are some common areas that are really challenging for a lot of people, whether it's later life, end of life, thinking about driving as we get older, Parkinson's. What tips do you have for these more difficult types of conversations?
I think it really starts with, before we get to that point, have we been having those conversations along the way? Because I can see the problem that happens is there's been no communication. My disease is progressing. Maybe my movement disorder doc says, it's time that you stop driving. We haven't even broached that subject yet. And now all of a sudden, because we haven't even communicated about it, I don't know what to do. So I believe it starts with having that general communication up front. And if we have that, then we have those conversations of, you know what, I'm really scared about this. I'm really struggling with the thought of not being able to drive anymore. That's a fear, but what's the bigger fear that's on the other side of that? The fear of loss of independence. And so I think it's starting to share about it so that you can begin to articulate what the underlying fear really is. And once we can identify that, we can do something about it.
So there's the talk early and talk often of it, right? Bring it up long before it's an issue, normalize it. If you haven't had great communication till now, what's the one thing somebody can do today?
Start doing it. Let's talk about it. And how can we begin that process of being together?
And you can say, hey, I just watched this video. Will you watch it with me?
Right.
Can we talk about talking? We talked about how words are our main form of communication, but for some people, words become a challenge. And that could be, I'm off, my medication isn't kicked in, I feel tired, or it could be that Parkinson's is progressing and speech is more difficult. What can both people with Parkinson's and their loved ones do in those situations to stay connected?
As the disease progresses, challenges in finding the right words. You want to talk, but there's this disconnect between what you're thinking and what you're saying. You can't quite get the motor part to come out. And I think one of the key parts of that is we have to oftentimes begin to rely more on the non-motor and the things that we can control better. Having eye contact with people, being actively engaged. And maybe it's things like just holding hands with your partner, right? Feeling some type of a connection that doesn't have to be words.
What's the one thing you want to leave our viewers with?
Communication is a muscle, right? And so the more we do it, the better we get at it. And so I think it's taking the time to evaluate what are the things that I can do to be a better communicator and start there.
Thank you so much for sharing such helpful guidance.
Thank you, Rachel. Enjoyed it.
Parkinson's can change how conversations flow, and it can also affect how we feel about ourselves, our relationships, and whether we feel comfortable talking about what we're going through. My hope is that this video helps those changes feel more understandable and less isolating. To learn more, visit michaeljfox.org/askthemd.